Hello, my name is Mr. Ash and I'm a consultant gynaecologist. What I wanted to do today was introduce what we do at the Sexual Wellbeing Clinic. We have various clinics through the Northwest and we work as part of a team. I am a consultant gynaecologist as part of the team. We have a consultant urologist called Mr. Ian Pearce who deals with the male side of sexual wellbeing, and we also have a psychosexual therapist, Emma Matthews, who covers the psychological and psychosexual aspects of both male and female sexual issues. We have clinics through the Northwest. We have clinics at the Beehive Centre in Chester. We also have clinics in North Wales, on the Wirral, in Liverpool and in Manchester. We can be contacted through our website at sexualwellbeing.com, and appointments can be made directly through our website or the clinics that are listed there. What I wanted to cover this morning is the sort of things that you might wish to see myself, a gynaecologist, about in regards to sexual wellbeing and what might happen at the clinic during the consultation. My normal consultations are 45 minutes long, and for the most part what I like to do is give women time and space to talk about any issues they're having. From my gynaecological perspective, issues can cover a multitude of areas, and they can be both to do with the physical aspects of sexual difficulty, but also the emotional aspects and the physiological aspects. And I tend to find that from a gynaecological point of view, issues tend to fall into two main categories. Women can have physiological difficulties before the menopause, either in terms of pain or bleeding, and after the menopause, very often menopause or hormone-related difficulties, either physical, such as hot flushes, or physical, such as pain or discomfort. Now, what I tend to find is lots of women have put up with symptoms for quite a long time before seeking help, and therefore I think time and space is important, because there are very many avenues that need to be explored, both in terms of their background, the issues they're having, and as far as their relationships are concerned. And very often women are quite anxious and maybe haven't discussed these before, either with a partner or with a medical professional. Sometimes an examination is necessary, but not all the time. And usually, for the most part, the sort of therapies that I offer might include some tests, but generally include medical therapies, which might include tablets or creams or pessaries, or treatment with, for example, dilators. But surgery is sometimes required, but I don't feel that that is certainly not a first step in most women, and very often improvements in either pain or discomfort or physiological aspects of sexual wellbeing can be improved without surgery. If surgery is required, my normal operating is at the Smile Marford Hospital on the Wirral, which is obviously a private hospital, but generally surgery for the most part is a second or a last resort. Lots of women are anxious about having a physical examination when they come to our clinic. In most cases this isn't necessary, and in actual fact all of us at the clinic do offer remote either telephone or video consultations. A face-to-face consultation is obviously the preferred method, because we do have a lot more interaction with patients, and the ebb and flow of questions and answers is easier. But lots of women do find it less anxious to be in a remote environment. As far as other aspects of the consultation is concerned, sometimes women are quite anxious about coming to see someone. They can bring a friend with them if they wish to, for support and also help. And also an extra pair of ears does sometimes help in terms of listening to options as far as therapies and treatments modalities is concerned. We are primarily based in the northwest of England, but because we are set up to offer remote telephone and video consultations, we can offer treatment to anybody based anywhere in the UK. Patient information leaflets are available on our website at www.sexualwellbeingclinic.com. Our contact numbers are also on our website. We're a very approachable team, and if you need an initial conversation about what we might be able to offer you prior to making an appointment, then please do get in touch and one of us will speak to you as soon as we can.